Well, I think the first thing that's very important to understand is that there's been a controversy over the safety of anticholinergic agents over decades. And the ASCENT study provides a great deal of confidence that these agents are safe in patients who even have a high risk of cardiovascular disease. That is to say, there was no difference between those treated with aclidinium and those who were not in terms of cardiac events. And in addition, there was a benefit in terms of reducing the prevalence of exacerbations. No, I think this is very important and was somewhat surprising that the drug was just as effective in patients who were at high risk of exacerbations by way of having had a previous exacerbations as those who had not had an exacerbation within the preceding year. So the proportional reduction in risk in those low exacerbation patients was actually greater. It was about 31% reduction compared to 20% reduction. So even though the number of exacerbations was less, the proportional improvement was greater. What this tells us is that there's a broad population of patients with COPD who benefit from long-acting antimuscarinic agents such as aclidinium. Well, we know that patients with COPD have a lot of comorbidities, and one of them is coronary artery disease. So they do have a high prevalence of coronary artery disease, and those patients who have exacerbations are thought to be at risk for having more cardiac events. So aclidinium would be a good drug in those people insofar as it's safe. There was another study that was done on just those patients who were taking beta blockers. And beta blockers as a background therapy might be considered to be a group of patients who would not particularly benefit from aclidinium. As it turns out, those patients on beta blockers had about the same reduction in exacerbations as those who were not taking beta blockers, but they actually had a better response in terms of spirometry improvement in FEV1.